Good morning, good afternoon. Thank you so much for following us. And today's video, we are going to talk about periodontal ligament. Periodontal ligament is, of course, one of the components of the periodontium. If you have not subscribed, please click on subscription and we continue. Perio means around, dental means the tooth, and therefore when we say periodontal, we mean the area around the tooth. Remember, we said the cementum, the periodontal ligament, the gum or the gingiva, and alveolar bone. All these are components of the periodontium. Therefore, we are talking about the periodontal ligament as one of the components of the periodontium. What is a periodontal ligament? Periodontal ligament is a connective tissue that surrounds the root and connects the tooth to the bone. If this is our tooth, the alveolar bone is where this tooth sits, and anything here, this area that surrounds this tooth, this is the periodontal ligament, and therefore we are going to talk about this area. Thank you. What is this periodontal ligament? This area that surrounds the tooth is composed of cellular, the cells, and extracellular substance. The cells that form, or you can say cells, the cells that form the periodontal ligament include mainly fibroblasts, but we can classify them into synthetic, resorptive cells, epithelial cells or masses, and felt cells. Where synthetic, these are cells that participate in formation, as the word synthetic. And therefore you can see osteoblasts. Formation of what? You know osteo. You can guess what it means. Fibroblasts. You know what it means. Blasts. All these are formation synthetic. Cementoblasts. You know what it means. Resorptive. Now these ones they tend to do what? To do away the class. Osteoclasts. These ones form these ones. As we shall later see in the functions, we have to remember the functions of remodeling. These put, these reduce. These put, these reduce. That's why you see we have some that form, others remove. We have the epithelial cells of masses. We have the defense cells, of course, the masts and what? Macrophages. Yes, a question can come outline the cells, the cellular cells in the periodontal ligament. You shall memorize them. Synthetic cells, e.g. osteoblasts, fibroblasts, cementoblasts. Resorptive, e.g. epithelial cells of masses. Then defense what? Cells, e.g. mast cells and macrophages. We need to move the extracellular substance. The extracellular substance, this is usually most of it ground substance, but we also have ground substance. For example, glycoproteins also have fibers, like collagen what? Fibers. As simple as that. We need now to talk about the different the different types of these cells. After talking about these fibers, we now need to talk about the majorly have a gland substance and fibers and the extracellular substance. But these fibers, there are many, but we group them into 5 major principal fibers. And therefore we can have a question that give or explain, or by use of a diagram, outline, or by use of a diagram, label or indicate different types of principal fibers of the periodontal ligament. And this is what we are going to talk about. We have this as our tooth. As our tooth, we have what we call crest fibers. Of course, this is our tooth held in the alveolar bone. This is the alveolar bone. We have what we call the crest, alveolar crest. Of course, you shall remember the alveolar crest. This is the alveolar bone, but where the bone at the tip of this alveolar bone, this is called the alveolar crest. This is the alveolar crest. The whole of this is alveolar bone, but here is alveolar crest. So these fibers that connect from the alveolar bone up to this cemento enamel junction. This one. And also this side. These are alveolar crest group. We can have them this side and this side. So this is the alveolar crest group. Very important. What is the function of this? The function of this is to support this tooth in order to retain it in the socket firmly. Retain it in the socket firmly. It opposes lateral forces, either this side or this side, to oppose any forces that happen on this tooth. It prevents extrusion from coming out. It is supporting it. Extrusion. And lastly, to prevent intrusion. Maybe as any force tends to push it deeper, to push it down, it is also what? Prevented. Retains it in the socket, opposes lateral forces, prevents extrusion, and prevents intrusion. We have the second group called horizontal group. Of course, running from the alveolar bone to the cementum or to the tooth. Of course, you shall remember that the root of the tooth is covered by the cementum. So I can say from alveolar bone to cementum, or from the alveolar bone to the tooth. These are, of course, even this side we have the horizontal. Just below the alveolar crest group, the horizontal. These restrain lateral what? Movement, lateral tooth movements, or horizontal what? forces. Very important group. The next is oblique. Oblique, of course, running from the alveolar bone, rather from the tooth, the alveolar bone. Alveolar crest. Can also have them. Don't confuse them with this. These were from here up to here, but these are from here up to where? Up to there. So oblique type is very important and is the largest. This is the largest group of all of them. They resist vertical and intrusive movement. Of course, the moment they are eating occlusal forces, most of the forces are supposed to cause intrusion because of the forces as you're joining this together. But this is the largest group that prevents what? Intrusive what? Movement. We have another type called apical. Apical, found at the apex. Here, apical. The apical group. Apical. When you look at them, at here is where we could be having maybe the apical foramen, or the foramen, or the hole where a blood vessel moves out. Moves out. And there we have what? So, you could think an obvious importance, before I forget, preventing blood vessels and nerves. It protects blood vessels and nerves around here. Resists laxation. Prevents tipping. Because they are strong, so they prevent the tooth from what? That movement, what we call tipping. The last group is the interradicular. Now, interradicular, inter means in between. Interradicular means the teeth are multi-rooted. So, in between the two roots. One root and the second root, interradicular. So the interradicular, it resists what? Tipping or what? Laxation. That is the importance. Lastly, we are going to look at the function of the periodontal ligament. One is the physical one. Transition of forces from occlusal to the bone. We can have a force here, but it may not reach the bone without using what? We're using these forces here. So transition of what? Of forces. Resist the impact of the forces. Sometimes the force is much, but these fibers caution or absorb what? This force. Attachment of the tooth to alveolar bone. Of course, this is the tooth and alveolar bone is here, so they kind of what? Connect. That is why you are able to eat without any fear. Nutrition. We already talked about how blood vessels pass through here to the what? The bone, and of course they are supported by what? By the tooth. Don't forget that there are also microscopic canals which may be in the sides, but this is the gross structure of a tooth. But microscopically, we like it to have also what you call lateral canals. We have remodeling. Remodeling, we said we have cells which take place in building and others reducing. That's why we're talking about osteoclasts and osteoblasts. Fibroblasts are fiber what? For fibroblasts. Those are what? Cells of resorption and what? And remodeling. By doing that, we are doing what? What called homeostasis. If you think this video is really helpful, kindly subscribe to our YouTube channel. Thank you for watching.